So this is an idea in which AI answers call bells to assess patient needs, and it directly notifies the correct personnel. So they're addressing the delay in responding to patient needs in the healthcare system. So patients often struggle to communicate their needs effectively. This would be due to a language barrier or anything else. It leads to increased waiting times, and it can potentially be a misunderstanding of what they need, which in return decreases the quality of care. And then the idea is to implement an AI-powered call system that not only alerts staff and a patient needs assistant, but also assesses the patient's needs and ranks therapy in terms of which is a greater priority. When a patient presses the call bell, the AI analyzes what the patient requests and identifies the urgency and nature of the request, and it notifies the appropriate staff, such as the nurse, doctor, or tech. The system could also include an AI translator to facilitate communication with patients that speak different languages, ensuring clarity in urgent situations.
So this product is unique because there's currently nothing out there like it. But the point is to integrate different systems. So you have, say, your call bell, then you have the person who answers the call, and then if there's a language barrier, now you have to get the language line. So the point is to try and put all these things into one by having machine triage your concern to the right person. This also makes it so that we're reducing time it takes to address a patient concern if there's a language barrier, because we all know that language line, even though it's absolutely a patient right, something we should be emphasizing, establishing, it does take a lot of time because you have to figure out what language they speak. You have to get an actual language line, then you have to wait for the person to get on the call and go through the whole protocol. So it should cut down, that's a good 15 minutes, 20 minutes you're cutting out of the time it takes to address patient needs. Additionally, with this, now, obviously patients don't know how heavy or how urgent their concerns are. So this way we're avoiding, just looking past certain symptoms. So if the point is a patient presses the button okay, yeah, I'm feeling cold, I'm feeling really tired, I'm feeling lightheaded, okay, well that's not good. So that will be a top priority. Now, if we have a patient, I will go to a nurse or provider. If the patient's saying okay, I have to use the bathroom, or I've gone to the bathroom, I need to be changed, or their Foley's out, or an IV is out, that's not obviously life-threatening, but it's still a concern we want to address as quickly as possible for infection risk, skin breakdown, all those types of things. So that will go to the nurse or the tech, and we'll be able to walk in there, address the patient's concerns, and keep pushing. Now, when we have concerns someone's clicking the call bell a million times and it's, well, I want water, I need a blanket, I need this. At the end of the day, that's really not a top priority at all. So this way, we're correctly prioritizing the need. The patient feels like it's being addressed. AI is able to respond to certain things, and the tech or the nurse will have it in their docket of things to do, but it will be low priority. That way, we're staying organized with what concerns we need to address, and making sure that we're having optimal safe care, and still addressing everybody's and still having a good consumer experience. Sorry. And then the last thing also, for another example, with patient NPO, if you put that into their chart, the goal is that now you're able to set the AI to the patient's NPO. So they make requests I want food, I want water, your NPO. So it's the AI will be able to explain that or reiterate it. So now it's not us front facing to the patient we're always telling them no. It'll be more the machine, which will offload the aggression more from the nurse to the machine more so.
So we would want to sell this product to hospitals, rehab centers, nursing homes, anywhere that there is someone inpatient. And in those inpatient areas, it's really crucial that we give time to patient care. And as far as the translation services, we would want those in inpatient and outpatient centers, so it can really go to a lot of different areas in healthcare. Our second idea, is Discharge Plus, which is an AI discharge quiz. We would be addressing unsafe discharge with this idea. We would implement the use of AI software, which would create a quiz for each client to take at discharge, ensuring that they comprehended and understood their discharge instructions.
So the idea is similar to a ChatGPT when you're doing practice questions type of thing for an exam, and people do that. The idea is that the nurse is going to log different main points that the patient needs to be able to understand to have safe discharge. And so they're able to, click different priorities, kind of like when you already go into Epic and click what patient teaching you've already done, but this way, now the AI is able to take those points, put it into a quiz, and you can either do a teach back method, where the patient will just talk back to you, you're able to log what points they did get and didn't get, and then, or they can take it on a hospital device, and the whole point is that whatever points they're not making, the quiz will then be reformed or restructured to re-emphasize the points that they're not understanding, and then, what's unique about the product is there's still not really anything out like this now, and it's not even a super drastic change, but it's something that we can use to make sure that we're accommodating all different teaching styles for patients. Because I feel like most of the time we kind of just do brochures, we bring in an education professional, or we just kind of say things that patients give some variation of the teaching back, and then the whole point is that it's just more personal and that we have better comprehension of discharge-relating.
This product would be targeted to hospitals, urgent cares, outpatient centers, surgery centers, mental health facilities, rehab centers, anywhere where someone's getting discharged.
And overall, the AI discharge